Hello, everyone. My name is Dr. Elisa Shipon-Blum. People call me Dr. E. I am the president and director of the Selective Mutism Anxiety and Related Disorders Treatment Center, or the SMART Center. I am the president of the Selective Mutism Research Institute and the founder and director emeritus of the Selective Mutism Association. I am super excited today to present SMART tips for a successful holiday season for children with selective mutism. So welcome. I'm going to give a brief background to the evidence-based treatment, social communication anxiety treatment that I developed. Selective mutism is a social communication anxiety disorder where mutism is a symptom. It's very important as we talk about this webinar and all the ways to help children and teens feel comfortable over the holiday season to not focus on speaking, but understand that when a child is mute, it's a symptom. And we need to respect the individual's baseline stages of social communication. Know when to bridge up and know when to bridge down. With the stages to the left, you see 4 stages. Stage 0 being non-communicative. That's when your child is either completely ignoring somebody else or they're completely shut down. So they could be talking to you but ignoring someone that asked them a question. That's a stage 0 child. As time goes on, in most settings, individuals become comfortably nonverbal or maybe uncomfortably nonverbal. They may respond, but initiating could be difficult, stage 1 and 1B. So understanding their baseline is important. Given time, we expect lower anxiety and a child will progress across the bridge into stage 3 or verbal communication. Yes, I ignored stage 2 for a second. Verbal communication is quiet, barely audible, 1 to 2 words. Stage 1A responsive or initiative, stage 1B. However, I have learned over the course of my career that for many children, especially the older they get, the more difficult it is and the more conditioned their behaviors become, and they get quite stuck. So that transitional stage, stage 2, is the missing link to treatment. So we will be utilizing stage 2 quite a bit in treatment because we cannot just, with lowering anxiety, get a lot of kids to be able to just speak. So that transitional stage, whether you use up the verbal intermediary, sounds to words, or using augmentative devices, is a way to help with that transitional strategy to be able to progress into speech. And what we will do when we are assessing a child, we will understand their baseline, so at least we know where to start to be able to progress them using strategies to get them across the bridge. So in addition to the stages, we want to respect the individual's whys of SM. This is a big part of my work and my research over the course of my career, where I have learned, again, mutism is a symptom and children may present timid with social anxiety, highly sensitive. 30 to 40% have underlying speech and language difficulties, either developmental or acquired as time has gone on, and they haven't had opportunities for give, take, back, forth social communication. And they develop usually more of an expressive language disorder, although we do have individuals that have an understanding or receptive speech and language disorder. Bilingualism is a factor into the development of selective mutism and may be also maintaining it. Having learning issues, if your child is struggling in school, the most common learning issue we see involves processing information, either auditory or in any way where it's difficult for them to take in the information, start, complete tasks, follow a series of directions, and their academics are being affected. So that's something to think about as we're planning treatment. And I had to mention high expectation. This is when you may have a child that's basically in the stage 0 or barely stage 1 area on the bridge, but we're expecting them to go up and ask questions without preparing, put their thoughts together, and be verbally initiative. So high expectation is focusing on speech when they're not yet ready, or you're expecting way too much for them, and that will cause anxiety and that will cause avoidance. Low expectation is when we do for them. We speak for them, we cover them up, we basically allow complete shadowing of the child where we or others are speaking and doing for them, so they aren't building the social communication skills. Why am I saying this as I'm presenting a webinar on holidays and how to help kids become more comfortable and giving you some tips and strategies? Because you need to know this about your child. And one of the things that we do and is very important is we do a selective mutism evaluation or a selective mutism interview to learn about this to be able to plan treatment. For a child with selective mutism, the preparation for social events and changes in routines, this sounds like, not necessarily intuitive here, but it's very anxiety provoking. For many of us, we can be very excited, looking forward to it. We are counting down the days, but as the holidays approach and all sorts of social events occur and changes in routines in school with parties, assemblies, big parties out of school, etc., this can cause a lot of stress for a lot of our kids who thrive on routine, predictability, structure, and consistency. That's something really big that we put into every single treatment plan if a child needs it, is structure, consistency, routine, and predictability in their life. So here we are during the holiday season when everything is everywhere and there's so much going on. One of the things that I'm going to mention, and I'm going to mention it throughout, and I mentioned it a lot at Communicamp and in all of my podcasts, is something called look, listen, and learn from your child. They tell you everything or almost everything you need to know about what they're feeling and how they're functioning just by observing them, listening to what they say to you, and then learning about it so that you can understand them. Very often when I consult with families, and this is something that has been going on for many, many years, where I'll meet with a family and you hear all about their expectations for a social event. What do they expect? We need you as parents to be realistic in your expectations. What is your child capable of at this time in their treatment? Are they capable of being verbally initiative and spontaneous, or are they capable of being engaged through handover, takeover, frontline, and using some nonverbal strategies? And I think, or transitional strategies. And I think a big part of this is really working with your treatment professional to help guide you to what your expectations should be in a realistic way. The holiday season, again, is one of the best times of the year to practice social communication opportunities. Again, it's anxiety provoking, but we can really see this in a positive way because there are so many opportunities. But as we're planning these opportunities, I want to go over a few golden rules that I implement into all of the treatment that we do. One, understanding that comfort precedes communication. And that makes sense, right? The more comfortable your child is with an aunt, an uncle, a grandparent, or a buddy, the more communication progress occurs. Progress does not occur in a large group. Why do I say it? Because too often during holiday times when we have parties and assemblies and all sorts of big activities, even going out to stores where there's a million people, where we become surprised when our child bridges down and may not even be engaging when in the past, maybe they were starting to not only use you as an intermediary, but perhaps they were actually verbally initiating a full script to someone or saying something that they practiced. But now understanding that in the midst of a group, that can be difficult. So we want to build comfort, do strategies away from the group as a starting point for many of these kids. Social engagement, which is the key to communication, involves handing, taking, give, take, back, forth, because that's the fuel to social communication and verbalization. If a child is not engaging and shadowing you and not beginning to interact with somebody, even non-verbally, verbalization, expression, comfort, communication is going to be limited. So social engagement through frontline, placing the child in front of you, encouraging that so that people begin to interact, eye contact begins to occur. They start to ask questions. There's opportunities for your child to answer, even if it's through nonverbal, transitional, or verbal means of communication. But for every single individual, from a child all the way to an adult, Hand over takeover is such an easy, basic strategy, although for some, we may need to hand over takeover with them. So helping them put something on a conveyor belt, or giving a sticker to somebody, or a candy cane to somebody, or a gift to somebody. They may need help with that if they're not able to do that. Demystification is critical. I'm always surprised how many times I work with families or consult with treatment professionals where I will hear, I don't want to talk to my child about this. I don't want them to think something's wrong with them. I'm not the type of person that's going to make them ever feel that something's wrong, but I will help them understand that when something can be a bit scary or difficult, and there's definitely ways we can help them so that they don't feel scared and that they're able to accomplish something, because the children know, they know they're not able to verbalize. They know that it can be very difficult. They know that they feel scared. And so not to acknowledge that or help them to be able to do that is actually something that's, I find, is a really limiting factor in trying to treat these kids, because what happens is they don't gain the inner control and understanding to be able to make that progress. So acknowledgement and assessment, acknowledging something's hard or scary, assessing it. And we use feeling scales in all different ways to help them be able to rate and grade their feelings. And we use the social communication bridge, where children and teens will make their own bridge to understand where they are in the social communication process, because what that does is that helps them understand, gives them the control, and demystifies this with them, and their anxiety goes down. It's amazing. The importance of asking and answering questions. Here we are, the holidays. How many opportunities are there to ask and answer questions? So many opportunities, whether you're asking for something in a store, whether you're out with some family at a restaurant, whether you're at a party and someone's going to ask a common question. How are you? How is school? What grade are you in now? Are you doing any sports? Oh, are you going away over the holidays? What gift do you want? Millions of questions are going to come at these kids. And so we want to help them at the stage that they're capable, while we facilitate social communication opportunities, as well as the strategies to bring them into these encounters or to help them be able to achieve this. So the importance of asking and answering questions is going to be involved in what we talk about today. Also want to minimize the need to think and process. Why am I saying that? Because with anxiety, and any of us can think about this, that when we're nervous, we can't always think straight. And you hear that statement, I'm nervous, I can't think straight. So the more that they can see through visuals, the more that they can hear through choices that they hear, the more that they won't need to process. The more repetitive tasks, the more repetitive types of activities and strategies that they do, the easier it gets, because it becomes something known and they don't need to think and process. I listed at the end, don't wait, facilitate. And we see this in our work and our research and in our treatment, is that parents, teachers, and those involved with the children, and even for teenagers, to be able to set the world up, to be able to facilitate social communication opportunities, just by the way you bring them into social communication um, interactions. For example, if someone says, hi, what grade are you in now? Do you say to your child who's not yet necessarily even engaging, tell them what grade you're in? Or do you give that answer yourself? Both of those answers, tell them you can do it, you can do it, is pushing and kind of forcing it when they may not be prepared or ready. And by you answering, by you doing, is actually enabling or literally minimizing their opportunity to interact and engage. So we want to facilitate in the right way based on that child. For a child that's not verbalizing with somebody directly and it's difficult, we want to train parents to bring the child into social communication via the asking a choice question. Are you in third or fourth grade? Something as simple as a choice, no answer. Are you in third or fourth? No answer. Tell me. And they start using their words towards you. This can be used in restaurants, in stores, with family gatherings, at assemblies, at parties, anywhere where somebody is asking a question. Just by the way, parents or teachers change the way they bring that child into that interaction will make the difference between success and not success. So let's break this down into different settings. Let's think about at home. What I would ask our listeners is, what do the holidays look like for your family? What do they look like? I would plan it out and think about it. Are you going to be having guests over? Are you going to be going to people's homes? Are you going away for the holidays? Are you staying home for the holidays? Is your child going to be going to school where they have parties and big assemblies and shows? Or is that not occurring? What do the holidays look like for your family? We want to prepare your child as much as possible for visitors and parties. It's not said in an anxiety-provoking way or a worried way, but in an upbeat, positive way. And why I say that is the more that they know, the more that they see what's going to occur, the more they get prepared. That preparation, just in a matter-of-fact way, is anxiety lowering. For many families, we recommend schedules, whether it's daily, weekly, or monthly calendars where the kids know what they're doing, when they're doing it, and so forth, because it helps them prepare. So if they're just simply going out to buy gifts, put it on the calendar, gift shopping, because perhaps your child is used to getting up, watching TV, relaxing, but now you have a whole day plan. Something as simple as that and preparing will help your child get ready. If you're going to go to a party, if you're going to have visitors over, prepare them for this so that they know. And I'm going to go more into this in a little bit. I talked about the more your child knows what to expect, the more in control he or she will feel. And what happens when we're in control? We feel less anxious. When we feel less anxious, we're able to accomplish more. We feel more relaxed. We look more relaxed, and we're able to communicate easier. Giving a child a role in the encounter is something I can't emphasize enough. I'm always amazed how many kids I work with that love to be a big shot, but it's at the big shot role that they feel confident in. What do they do that they feel proud of, that they can be part of for a social encounter? Do they love to bake with you? Are they great at setting the table and decorating the house? Are they great at playing games, and that's something that they can do with a sibling, a cousin, or even an aunt or an uncle? So what I'd like our listeners to think about is, what area would you say your child is strong with, that's confidence boosting, that we can implement into the family gatherings, the parties, the things that they're going to do, where that's lifts their confidence and as a result lowers their anxiety? Helping their younger sibling or cousin or maybe a friend's child. If you have a child or a teen with selective mutism and there's an opportunity to kind of have someone younger with them, someone they can take care of, someone that is under their wing, again, a confidence booster, anxiety lowerer. It could even be a pet where they take the pet around at the family gathering. Just having that pet near them is, again, something that's soothing, confidence building, and it also lowers their anxiety, and it leads others to question, and sometimes questioning over their pet and obviously a task, their younger sibling, cousin, is also a way to deflect questioning directly to them. Can't emphasize enough opportunities for social engagement. Remember, I said the more that we can work on social engagement skills, even as kids are verbal, stimulate social communication pathways in their brain. The simple act of giving something and taking something stimulates social engagement. That's what we need to do. So I need you to think about opportunities. If you have a very young, highly sensitive child and they're in a shutdown mode, that's not when we're going to do it. So respecting their warm-up time is going to be important. I've had many families prepare and practice and dress rehearsal for an event. They literally go through the evening's events for what they're going to do. They practice giving each other gifts. They practice setting the table. They make the cookies. They practice because that practice helps them feel comfortable. Holiday get-togethers. Most families are going to be getting together. And remember, I said progress doesn't occur in a group, and group activities for many of our kids are stressful, not just because there's a lot of people there, but because many of our kids are very sensitive. Louder, larger, lots of people environments can be overwhelming from a sensory perspective. I can't fix that. I can understand that. So we want to educate others on how to best engage and question your child. A quick text or an email, sometimes of giving them information, or even asking them to ask a few common questions. And I'm going to go over that. So we have something called the About My Child worksheet, which I'll show you in a minute, but we have that in the resource section on the selectivemutismcenter.org website. I developed that many years ago as a way for parents to share what their child is like, showing a picture if they choose of them looking relaxed and smiling versus what they look like when they're a bit anxious. We can share this with coaches and teachers and family members, but this is a wonderful way to educate others on how to interact and engage with the child so not to cause more anxiety. Because let's face it, how many of us have aunts or even uncles that are louder people that might run right up to them, grab them, and go, "You're going to talk to me today." And we don't want that to happen because that's going to shut down your child. For all holiday get-togethers, I want to respect a child's warm-up time. This is important, and I often give the example of a dozen roses, and I say this a lot, and you'll hear me talk about kind of common strategies, interventions, key components, different different things that we want you to know over and over. I'll say it because I want it to become part of your understanding and your vocabulary as you learn about the best strategies and interventions to use with your child. But most individuals, especially our timid, sensory sensitive individuals, need warm up time. And if it's an environment they haven't gone to and there's a lot of people, it's even longer. So I want you to think about a dozen roses and realize some open up really quickly, and some of our very kind of not timid kids, maybe a child that has otherwise of SM, maybe they're sensory seekers, maybe they have speech and language as their underlying issue and they're not timid at all. Or maybe they have speech and language difficulties and they're timid. The more timid, the more sensitive from a shutdown perspective, the more warm up time is needed. And so I would ask parents to think about that warm up time and have minimal expectation for interactions at that time. Allow your child to connect with you. Don't push them away if they're hanging out with you. Know that they aren't feeling comfortable and safe in that moment, and time will be needed. And maybe you're engaging with others with them by your side, or perhaps they're with a sibling or a cousin that they feel comfortable with. But we need to respect that. For any holiday gathering, please arrive early. I say that because it's easier for our kids to be there with others arriving after them than to walk into a filled environment. That is a really easy thing to do. And it's something that I highly, highly recommend. And parents will share with me, we got there 15 minutes earlier, and my child was so much more comfortable because nobody else was there. You may need to contact that aunt or uncle or family friend and say, "Hey, would it be all right if we just arrive a little early?" You might feel comfortable explaining why, or you might say, "Hey, we just like to get places early." And most people are welcoming of that because obviously you asked for a reason. If having a party at home, and this isn't always easy to do, but it's something that has helped many, many children, try to have some arrival times at different times. Maybe you have one family arrive a little bit earlier to help get things ready. So then one family arrives, then another family arrives. So instead of everyone coming at 5 o'clock, where all of a sudden you went from the 4 or 5 of you to 30 people in a matter of 15 minutes, stagger arrival times. Again, it's something that can be done and can be very helpful. None of the things that I'm mentioning is the cure-all and end-all to this challenge in terms of comfort and social communication, but everything adds up together. And as we're doing it, anxiety is lowered, 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 lowered. And the more we can work to meet the child where they're at and lower the anxiety, the more confident they'll feel, the more comfortable they'll feel, the more in control they'll feel, and the less anxious they'll feel. And the more, as we are facilitating strategies, the more communicative they will be. Again, give a child a role in that encounter. I have so many amazing bakers. I don't love it when they bring in a ton of cookies to our center because I'm going to eat them. So I'll put them in the kitchen. And we will have the different staff eat those cookies a lot. But anyway, we have a lot of bakers and we have a lot of artists. So anything they can do to kind of be involved in that encounter gives them the confidence. I have amazing table setters too, and they'll put some of their homemade different art projects on the table. For Thanksgiving, I had a patient last year make a turkey, and they had that turkey in the middle of the table, and that alone made them feel really comfortable. They can also be the passer outer of different things at the meal. Maybe they go with a sibling to help them pass things out, taking coats, giving out sodas, giving out cookies. I also see this as an opportunity for some of our younger guys to give out stickers, holiday stickers, giving out gifts as we're sitting around the tree or we're celebrating Hanukkah, whatever the holiday may be. But obviously, we as parents sometimes think it's easier to just do it ourselves, but we want to encourage our children. And sometimes, as we're playing the games for younger kids or doing the goals for the older children, these are ways they can get points, and external motivation can work very, very well for our kids that are working towards a goal, whatever that goal or goals will be. I talk about common questions. Why do I talk about common questions? Remember, I said one of the golden rules was question asking and answering. I also talked about minimizing their need to think and process. Well, common questions do just that. People, when you see them, are only going to ask certain questions. They're going to ask, how is school? What grade are you in? What do you want for Hanukkah or Christmas? They're going to ask you these questions. They're going to ask your child those questions. And so being prepared for these questions, we write them out, we chart them, we draw pictures for the younger guys. We'll do I Spy the common question. We'll be on the lookout for the common questions. So by doing this, you're helping prepare your child in an upbeat, positive way. And for younger children, they will play the games. And for older kids, the teens, they'll be on the lookout and they'll record them and they'll be ready for them. And we will role play these common questions in our sessions. Common questions and greetings, and I'll talk about that as we move along as well, are part of what we call action plans for older kids and teens and sandwich questions for younger kids. And this is when we think about a sandwich where we think about the greeting being the top bun and saying goodbye, the bottom bun, and then the questions in between. So an action plan consists of the greetings, hi, how are you? But what questions can be asked in a different setting? Who's going to be there? But what questions are going to be asked? What is the answer? What question can you ask? So thinking about a social encounter and preparing for it, again, upbeat, positive, but the child being prepared and ready in a game-like manner with points, but the child that's older working towards that goal is what we need to do. And I think what you're hearing from me, and this is something that I can't change, is that lowering anxiety is not enough. It takes these strategies, it takes these interventions, it takes these working in the trenches in social communication opportunities to be able to practice so that these interactions occur in a positive way. Because if we don't prepare for common questions, many children will shy away, they'll shut down, they'll avoid, and anxiety will rise. So being on the lookout is a way to bypass the amygdala, that little almond-shaped area of the brain that causes shutdown. So the more we can get cognitive, and cognitive behavioral therapy is a really big part of SCAT, the more this child is aware and thinking, and the more this can be successful. Small group interaction is best. Remember, the number one golden rule is comfort precedes communication, and progress does not occur in a group. So building comfort, doing strategies away from the group leads to more success than in the midst of a hubbub of a group. So in the kitchen, in the den, in the versus the big living room. In the kitchen, this is a great way to help the child can help get things ready, be near you, be near a sibling, as a way for distraction rather than standing in the middle of a living room waiting for questions or shutting down. So we do want to think about what would work best for your child. And again, we can implement that big shot role as they show off or get together with their aunt or a cousin to make the cakes and the desserts or prepare a meal for the event, and that is a confidence booster. So all of these little things help. Involve your child in every single conversation. Why do I say this? Because there's two ways. There's the contrived, getting ready for action plans, interview questions, assignments, different activities we do with family members in a fun, upbeat manner. Or for the older kids, it's more assignment based, probably outside of a holiday gathering. But we want to do back, forth, give, take, social communication opportunities. However, what if people just ask a question? Are they going to ask, how is school? Or are they going to ask you what you think about global warming? Chances are they're going to ask a common question. So, what are we going to do? We're going to know what your child is capable of based on what your treatment professional tells you and how you're working in how your child is doing in treatment, what stage they're at, but you are going to help involve them in those situations. So with younger children, it might be the way you ask a question. And we talked about it before, bringing them in by choice, asking again, no answer, tell me, and repetitiveness by using words towards somebody often leads to louder speech where the person can be taught to repeat without eye contact. This is a very viable strategy that works wonderfully with younger children or even elementary age children. The older the child is, the more they're in the preteen, teen years. Verbal intermediaries don't tend to work as well, but sometimes just a simple choice and educating others to be able to ask questions that way helps. This is an About My Child worksheet. Again, I shared that it's on our resource page of our website. This can be personalized, and what we have is a PDF that's fillable that you can add information about your particular child. And you can include whatever it is that you feel comfortable with. But here's an example of a child that I work with, and this is from many years ago, so he's a lot older now. But all we're doing is sharing some information about the child and the best ways to interact with your child. And again, it's about your comfort in using this. And for some of my older kids, I've actually had quite a few of them write about me, ways to help me feel comfortable and telling them a little bit about themselves. Those are kids that are very engaged in the treatment process. They've developed motivation. They want the help. They want to make the progress and they want to cross the bridge into speech. Let's talk about school. Well, school, we're thinking about assemblies, plays, class parties. It's pretty much endless and lots of changes in schedules. Preparing the child for any of these changes is very important. So, what I like our listeners to think about is as I'm reading through this and I'm talking about this, I want you to think to your mind, check, I'm doing that. Check, I'm doing that. Or no, I'm not. And this is something I can do. So, yes, listening to me is a great start. Some of these things are common sense. Some of these things are, wait, why didn't I think of that? And they're basically easy to do, but I'm amazed when I go through this with families. So many don't do this. Teachers don't do this because they either forget or they're just so busy. But let's think about implementing many of these different things that I'm talking about throughout this entire webinar in your child's strategies and interventions that are used as we get through the holidays or any time of year, frankly. So, preparing for the changes in routine, is that something you're doing? Talking about the assemblies, the plays, the class parties, who's going to be there, what is their role in the play, and so forth. When are those assemblies? Knowing on the schedule when that is. So as teachers are sharing with parents, parents are adding that to their schedules. They're putting that on their big poster boards that are in the kitchen area. Sit child with their classroom buddy. If ever there's a time to be near a comfy buddy, it's now. It's during the holiday times when you're going to assemblies, pairing and grouping that child with a buddy. If they're in a play, pairing and grouping that child with a couple buddies. And if they're at class parties, even if a parent is there, sitting near another child that that child feels comfortable with. Sitting on the outskirts during those parties is also something I recommend rather than the midst of the hubbub, similar to parties in the home environment where we want to help them kind of be on the outskirts, the kitchen, the den versus the middle of the busy living room. By the way, it doesn't mean they won't go in the living room, but maybe not at the start of the party. Discuss the child's role in the performance and expectations with the teacher. It's important that you talk about this for parents listening with your treatment professional and also involve your child. For some of the older kids or even the younger kids, You can really talk to them about this. Again, it's how you talk to them about this. We don't want to scare them. We don't want to make them worried, but we want to be realistic about what those expectations are and what their role is. Are they holding up a sign? Are they just paired with a buddy? Are they wearing a costume? I have kids that love to wear costumes and they feel safe in that costume. Are they not performing in the show this year, but they're helping with setting it up, like the stage crew? I really want to be realistic about what would get this child through this social encounter in a really positive way. I've worked with older kids to be able to sit down and talk about their comfort and roll and come up with a goal for them to have for the class performance. And we will role play and we'll talk about it. And I have lots of kids that make huge leaps just by preparing, practicing, and being part of that decision making. Rehearse at home. I think that many do this, that if you do have a play, and even if they're playing an instrument rather than having a talking role, rehearsing at home and having some of their friends from class over. Also, more rehearsals at school. So if there's 3 or 4 rehearsals, maybe the parent, the child, and a couple buddies, and maybe other people in the show practice a few extra times just to be able to be comfortable. Do not use this situation of doing plays, class parties as a test or too much of a challenge for your child. There's a statement called fear begets fear. Feeling fear creates that kind of repetitive nature of experiencing fear and then having it go on. We don't want that. Fear begets fear. We want to create an environment that's safe. You will get so much further in this process in terms of even further across the bridge, the more that you accept where they are and understand what is realistic, first trying to win the lottery, as I call it, trying to get them to go across the bridge and to prove a point. You don't want to do that. You want to be realistic, involve your older child in this process, involve your younger child in a realistic way. But for some of our younger preschoolers, early elementary kids, it's really setting up the world more for them than asking them too many questions. First, the older kids, we really do involve them in the decision making of their comfort and challenging them within reason. So if I were to use a 0 to 5 scale, and 5 is the hardest or scariest and 0 is the easiest, pushing them a 5 or above is too much. But moving them to a 2 or a 3 is realistic, because as they start to do a lot of their goals, you start to see, what did it feel like before I did it? It felt like a 3. And if I had to do it again, it feels like a 2 or even a 1. So helping them cognitively realize what they're doing and then reassessing it is a really, really critical component of treatment. So let's just kind of sum up some of our lowering anxiety techniques. We talked about look, listen, and learn. The 3 L's in this way: look, listen, and learn. We have to be realistic. And what are our children telling us? Are they sharing with us how they feel? Are they looking a certain way? Are they avoiding a topic? Are they completely shut down? Are they completely verbal in school? Where are they on the bridge? And we need to utilize that look, listen, and learn as we're planning our strategies. I can't recommend enough the buddy process. Just having a cozy friend near you is enough to just fuel progress. So that buddy process, and think about it. Where can you implement the buddy process? In every situation, whether you're shopping over the holidays and it's a sibling or a buddy and you're looking for things through the scavenger hunt for the little guys, or the store goals for the older kids, or you are utilizing the buddy process at parties, assemblies. It's endless. The buddy process needs to be there, and I can't emphasize it enough. Prepare, prepare, prepare in an upbeat, positive manner. I was sitting in session not too long ago, and a parent with their child, who was about 8 years old, sitting right next to them, said to me in session, I am so nervous about the upcoming holidays. I'm so scared that my child is going to completely shut down when she sees some of these relatives who she hasn't seen before COVID. Now, you can imagine the look on her child's face when this was said. I was like, stop, stop, as I was trying to tell her. But she kind of went on, and then we had to kind of redefine this for the child and come up with a way to help the child feel positive. So in other words, be very very aware of what you're saying and your child being near you. We want to be upbeat, we want to be positive, and we want to project our confidence in our children, but we also want to be realistic. We want to minimize any negatives that we share with our kids because we don't want them to think we're worried. We want to be realistic and we want to be very strategic in a way that they know what we're working on and we're a team. We're working together, mom, dad, whoever the caregivers may be, teachers working together as a team to help the child feel comfortable and make progress, whatever that progress may be. Have fun, be silly, and again, accept your child where they're at and don't try to push them beyond their comfort. I wanted to go over greetings. This is something that's very hard for many, many kids, many, many teens. And I say this because I believe that one of the reasons greetings are difficult for kids is because those are the things that we try to get them to do without understanding that maybe they're just not ready to say hello. So when we're pushing our children to say hello for the reason of being polite and not rude, sometimes we're pushing them beyond their comfort level and they become avoidant and more anxious to greetings. So here are the stages of social communication. We have many children that will play the waving game. Some of our little kids will just do the waving game to get them comfortable. It stimulates social engagement. How many people can we wave to? Some are waving to cats and dogs in the streets. Some are waving to people in buses. But practicing the waving game. And there's lots of different ways we have waving games. We have a lot of varieties of waving games. We have twisters and flappers and princess waves. We take one of their action figures and we wave with that. It really is about what the child feels comfortable with. And we can even chart the different types of waves and we play the waving game and we get points for the waving game and we work on the waving game. For some of our older kids where it becomes difficult, we will begin to we will do like a hand up, and that makes them feel more comfortable than a wave. So just a hand up, a high five for some. It really is about figuring out what it is they're comfortable with. We may do race to wave first. Who can wave first when we see people? You get focused on the game for these little guys rather than the expectation of, are you going to wave today? Are you going to say hello today? As kids are progressing across the bridge, we may even have a tape message in a goofy voice of hi or bye. We may do the hi bye copy game as they're verbal. Someone says hi, you say hi. You might beat them to say hi. You can see all of these different varieties of different games and goals that we work on. In action plans, we even work for kids that are able to say hello. So when someone says hi, how are you? They're able to say, good, how are you? I can't wait for my family trip. So we have them begin to expand their conversation instead of just saying good. How are you? Good. But how many kids do that? So they're verbal, but they're just not expressive. So we help them come up with I am, I just statements, and so forth. We talk about the big 5 words: hi, bye, yes, no, and thanks. Those are the big 5 words that we can use in every setting we're in based on the stage that we are bridging up to. And if you're in a loud, large, lots of people environment, you may need to bridge down. So where your child might have been going, hey, how are you? Maybe now they're just doing a wave, or maybe they're doing a copy back rather than initiating it first. As we go out and about for the holidays, we're going to prepare. Where are we going? What to expect? And who's going to be with you? We role play, we respect the stage on the bridge, and we will choose smaller, less crowded, quieter places to practice our exposures. Think about that. Loud, large, lots of people environment is almost the definition of the holiday time. So when can you go to quieter, or I call it the 3 S's: silent, secluded, and small? Small environments to practice. One, it could be a big environment, but maybe during off times. So rather than going out at 2 o'clock to Target on a Saturday, maybe you go right in the beginning of the morning or right at the end of the day. So it's about practicing some of these strategies and exposures during off times so that your child can feel safe and not overwhelmed. We're going to practice all of these different skills. I just kind of listed a common outing: front line, where the parents gently place the child in front of them. We practice handover takeover, whether it's the bags from the clerk, whether we're putting the credit card into the machine or handing it over or paying for a meal, whether we are giving something to somebody at a coat at a party, it doesn't really matter. We're practicing high or by. We're bringing in, parents are bringing kids into conversation through how they ask questions. We're preparing with a script for some of our verbal children. Hi, do you have blank? Parent approaches and says, excuse me, sir, can you help us? Bridging down to, are we looking for this or that? No answer, this or that, tell me. Stage 2. Maybe they're showing their list. This is what should be guided by your treatment professional to have a positive experience. The more positive experiences, even if they're nonverbal or transitional, the more the anxiety is lowered and they're able to bridge up into verbal communication. So things to remember. The holidays are enjoyable for the entire family. They need to be. It shouldn't be a stressful time. I work with families where I can see that they're anxious about the holidays and I want to frame it so that it's positive and their children see it in a positive way. Respect, respect, and allow warm-up time. Some children will be clingy. They'll hang on you a little bit. Be okay with it and you be the facilitator where you approach somebody with your child near you and start engaging them. Bring a bag of props. Bring things to kind of focus on, whether it's a bag of some of their favorite toys or a picture out, something on their phone, like if they went to on a vacation not too long ago, or for some of the older kids, prep the relatives to be able to ask them some questions. I know that's not on this slide, but I'm just kind of coming up with some things to summarize. Respect their stage on the bridge, look, listen, and learn, and have lots of fun. I can't end this podcast, this webinar, without talking about my podcast, Unspoken Words. It's on Apple, it's on Spotify, it's off our website. This is my way, after 30 plus years of working in this field, to be able to share the knowledge that I've gained from the information that children and teens and adults have taught me, and to be able to help others. And this is my way of getting everything out of my head. And we have lots and lots of episodes, and I encourage you to listen and share, because again, this is my way of getting everything out of my head. For those that are new to the Smart Center, please know we offer lots and lots of ways to help you, whether it's an evaluation to understand the whys of SM and your baseline stages as a first step in treatment with us or with other people. We offer individual intensive programs, individual psychotherapy on a weekly or bi-weekly basis. We have our group program, which is very popular, our Communicamp program that's 7 to 8 times a year, which we have the intensive group within a school setting practicing skills. But it's not just for the kids, it's an all-day parent education and support program throughout the entire 3+ days as well. We offer weekly groups. We do testing and assessments for psychoeducational, for autism testing. We do all of that. We do independent educational evals for schools, IEPs and 504s. We do professional trainings, anything we can do to support you and help you. For those that need support, we do offer financial assistance because we don't want costs to get in the way of you getting the help that you need.